Hello, my name is Leanne and I did my CSI at Tuesday, 8:30 a.m. in the morning till 12:30 p.m. Our patient was an 89-year-old woman with a wound on right lower leg, history of being home alone, independent, one person assists, fall precaution. She eats quick things, family's concerned, regular diet. She had hypertension, COPD, chronic venous, DVT. She got an IV antibiotic and ED. She had a venous status also. She haven't peed, hasn't taken nutrition. She's a full code. And then I got a notification saying that she has a bladder scan of 380 ml. And she's also allergic to penicillin. So for our for our CSI, when we got this, me and my partner first thought of what to do. And so, being said that she got a bladder scan of 380 ml, I thought, maybe they would need an in and out cath. And when we got there, we introduced ourselves. We looked at the chart on the provider's order. On the stat order, it said if it's more than 200 milliliters, the bladder scan needed to do an in and out cath. It's stat, and that is a 10 to 15 minutes. And after that, we did it, and then my partner was asking questions, talking to her. We also tried to give her meds, but we couldn't because we ran out of time. And I also tried to get her to take her nutrition. And to answer the cues and feedbacks, collaboration expands patient care by bringing together diverse expertise to address all aspects of patients' needs, improving outcomes, enhancing safety during Ms. Morrow's episodes of care. Multidisciplinary teams like the nurses, us, dietitian, providers, and pharmacists were all collaborating to help with Mrs. Morrow's needs. Those were all who we called on when we were doing our CSI. And then focus assessments help nurses stay organized by concentrating on the most important health concerns. This allows them to quickly find problems, take action faster, and use resources more effectively, improving patient care. To prevent CODI, I would make sure a catheter is used only when absolutely necessary, keep it clean, and remove it as soon as it's no longer needed. I'd also regularly check if it's still required and educate both the staff and the patient on proper care to help prevent infection. To ensure safety, I'd pay close attention to small details like the number of bed rails and the bed height. For example, I'd make sure to lower the bed when possible to reduce the fall risk and only use the necessary number of bed rails to avoid unnecessary restraint. I'd also regularly assess Ms. Morrow's comfort and safety to make sure she's not at risk of injury, even if she's technically in restraints, and adjust care is needed. In addition to the EHR, other valuable sources of informatics included collaboration with nursing peers and reference tools like the drug guide. For example, when performing the in and out catheterization, I relied on my partner to assist with moving the drape, ensuring the procedure went smoothly and safely. Similarly, the other group used a drug guide to look up an unfamiliar medication called zinc, which helped ensure the right drug was administered correctly. This resources supported safe, effective care by improving communication and providing accurate, real-time information. And some takeaways that I had during my CSI was always ask questions, always ask your patient for a question. There's always a reason behind why they're not wanting to do a specific thing. You just need to sit down with them, talk with them, and then they will explain it to you. And then another takeaway is don't be afraid to ask help. There are resources that will be able to help you, like during the drape situation, I asked my partner for help, and then I also should have asked her for help when I noticed that the bed rail was up, but at the moment I just didn't ask her at all. And then with our patient not wanting to take nutrition, the Ensure, a protein that she needed to help the wound heal faster and to be able to go home, she was refusing, and we could have asked her more like, why didn't she want it? What does she want with it? Things like that. And then overall, this CSI experience was a truly great experience to have. Thank you.